Hi, I'm Dr. Rahman, and welcome to Black Women's Health Podcast. Last week, I saw two articles about fibroid tumors. One was in Huffington Post, and the other was in Essence, and they were good articles, but they focused on treatment options, demographics and treatment options, and started to wonder after all this time, do we have something that we can tell women that they can do proactively to keep them from developing large tumors, symptomatic tumors? And today, I'd like to just talk about a couple options that just might make the difference in your life. One of the first questions that we have to consider is, are all women at equal risk for developing fibroids? And the answer is no. There are some women who have an increased risk for fibroid tumors, and there are three relatively large groups. There are women who are vitamin D deficient. These women have an increased risk for fibroid tumors. Women who have a family history of fibroid tumors may indeed be at a higher risk for developing fibroids. And then if you are of African American descent, you are at a higher risk for developing high fibroid tumors. That being said, is there anything that you can do to monitor the risk that you might have? And the answer is yes. Consider doing things which are relatively straightforward, like checking your vitamin D levels on a regular basis. Many of us are vitamin D deficient, and we may take supplements for a short period of time. But if we do that and then allow time to elapse, we may revert back to being iron deficient. So we should consider having a vitamin D level checked at least once a year. The other is we should check our iron level and our ferritin level to see if we have or we're at risk for developing iron deficiency anemia, which can result from too much bleeding. And too much bleeding can be the primary symptom for a woman who has fibroid tumors. So you may think this bleeding is normal when it's excessive. And it's excessive because you have fibroid tumors. So proactively check your labs, vitamin D, iron, ferritin, and periodically get a pelvic ultrasound. Nowadays, GYN exams aren't always done when you go to your gynecologist. So how would you know if you're developing? Don't wait until you're symptomatic. Get an ultrasound. Get an ultrasound to see, first of all, do I have fibroid tumors? And then monitor every 1 to 2 years to see, are they growing? To see how many fibroid tumors there are, how big are they, and where are they located. And then after you've done that, what can you do to keep them from becoming symptomatic? Fibroid tumors may be one of the few tumors that we allow to grow and do nothing until they become problematic. We may want to reconsider that now that there are other options available. So one of the things that you can do is, like we spoke before, maintain a normal vitamin D level. And that requires you to check it periodically and take vitamin D supplements as needed. The other is to avoid certain fast foods and hair care products which have chemicals in them which can promote the growth of fibroids. And lastly, you need to educate yourself about your options, treatment options. Not every woman with a fibroid needs a hysterectomy. So don't hold back because you're afraid someone is going to tell you you need surgery. There are many options from pills to procedures. There are also herbal remedies that are being promoted, not well studied, but are being promoted. And my recommendation is first, do no harm to your body. Check out the options. Discuss it with your gynecologist. There is no reason a woman has to suffer and endure the pain and abnormal bleeding, which is often associated with fibroid tumors. You have options. And this is Dr. Rahman saying, take this information, share it with a girlfriend, share it with your sister. It just may make the difference. Until next week, take care.